Hello, I am Dr. Raza. Today I'm going to discuss asthma, what are its triggers, and what you can do to avoid these triggers. Asthma is a disease in which your airways get narrowed on exposure to certain agents. Agents are not necessarily the things you are allergic to, rather, cold, exercise, and NSAIDs can also do that. It is slightly more common in male children less than 14 years old and in female adults. Asthma usually represents an episode of cough wheezing, shortness of breath, and chest tightness, but sometimes it can present a cough only without any other features, so called cough variant asthma. Asthma may be mistaken for a cold or a persistent chest infection lasting more than 10 days. Now I will discuss what are the triggers of asthma attack and how to minimize the exposure. House dust mite House dust mites are very small insect-like pests, not seen by naked eyes that feed on dead human skin, skin cells, and thrive in warm, humid settings. House dust mite abounds in carpets, soft furnishing, and bedding. If your symptoms aggravate after vacuuming the rugs, it means you're allergic to dust mite. In such cases, use impervious covers for mattresses, pillows, and comforters, and washing other bedding in hot water. Remove rugs from bedrooms and replace with hard floor. Limit upholstered furniture. Minimize the number of soft toys. Also use the mask when vacuuming. Smoke, if you smoke or someone else in your household smokes, can also trigger asthma attack. Number three are allergens from dogs, cats, and plants. If you have recently developed asthma, look for any changes in your surroundings, for example, new pets, plants, carpets, or rugs. Ask about pets, especially in perennial asthma. Number four is fungal spores and cockroaches antigens. To minimize exposure to fungal spores, keep humidity less than 50%. This will also suppress the growth of house dust mites. To get rid of cockroaches, don't leave food lying around the house, especially at night. Also, don't leave pet food and water out overnight. Keep all food in tightly sealed containers. Clean up food spills right away and keep your house dry. Other allergens are nitrogen dioxide from motor vehicle emissions and fuel burning industries, sulfur dioxide from diesel vehicles, and exercise induced bronchoconstriction. Exercise induced bronchoconstriction begins during exercise or within 3 minutes after it ends, peaks within 10 to 15 minutes, and then resolves by 60 minutes. Workplace triggers such as isocyanates, epoxy, resin, and wood rust. These three triggers of workplace cause so-called occupational asthma. Other triggers include infections such as cold, sore throat, rhinitis, and sinusitis. Drugs, for example, beta blockers, which are often used in coronary artery disease. Beta blockers can trigger asthma attack even in the form of eye drops. Severe stress sometimes can also aggravate asthma symptoms. Gastroesophageal reflux disease is an important cause which worsens symptoms of asthma, and it is also a common cause of chronic cough. Moisture slash humidifiers, as mentioned earlier, keep humidity at home less than 50%. 6. Exposure to hot or cold.